Disaster Recovery Plan, Elizabeth Sloan. Valley City Regional Hospital is struggling with the consequences of a train disaster that happened 2 years ago. The hospital is located in North Dakota, a place with a population of 8,295 people. Despite the budget limitations, this 105-bed acute care hospital is already planning for likely tornado hazards. Capella University, 2024. Specifically, our current disaster recovery plan seeks to rectify past failures and build a better framework for the future, focusing on reducing health disparities and increasing service accessibility in the context of a disaster. This presented presentation utilizes the MAP-IT framework to develop a comprehensive, community-based rehabilitation plan, outlining the strategies of engaging stakeholders, assessing community needs, planning, implementing interventions, and evaluating outcomes. The aim is to create a strong, disaster-prepared, disaster recovery community with equal rights to health care for all residents. The first strategy is to mobilize influential players to form a broad base of supporters and collaborators. Community Toolbox 2019. This group will comprise hospital staff and management, City Hall emergency personnel, fire, police, schools, community leaders, NGOs, local businesses, and minorities, to gain as much feedback as possible and involve as many community members as possible to make the final decision. Scheduling meetings frequently to foster cooperation, mapping channels of communication, and defining the responsibilities of each stakeholder category. Forming subcommittees for the different areas of disaster response will make for better focus. This will provide an excellent foundation for our disaster recovery efforts and ensure that every stakeholder has a voice and vision for the community's resilience. The evaluation of the needs of the community will involve analyzing special groups in the community and migrant employees, the existing resources and staff, and the budget constraints. Exploring the consequences of the catastrophe and analyzing the experience gained after the train derailment. The assessment will determine the health factors that dictate disaster resistance, cultural, social, and economic impediments to safety and recovery. Present emergency response shortcomings and resources available within the community. Surveys, interviews, health and socioeconomic data analysis, meeting with local experts, and analysts of previous disaster response operations. Such a vast evaluation will help us determine our further actions and guarantee that our policies consider the difficulties faced by members of the diverse communities to create bias for efficient and fair disaster relief. The ultimate goal is to establish a resilient community capable of managing disasters. The goals are in line with Healthy People 2020-2030 objectives, passing out health disparities and improving service delivery and developing a robust response mechanism, ensuring equal access to health services during and after disasters, and increasing community awareness of hazards and disasters, expanding the hospital's ability to manage surge capacity incidents, as well as the integration of a multi-sectoral disaster response plan and establishing long-term disaster resilient community resilience to different forms. These goals will guide our decisions and activities in the recovery process, making sure that we meet immediate and protected requirements in addition to improving community health. The formation of a detailed triage plan for mass indicants, the creation of a community health workers network for outreach and support, the formation of mobile health teams for quick deployment in the event, formulation of effective patient tracking and follow-up mechanism through the health information management, a 6-month plan for first stage of recovery that involves creating and training emergency processes with staff during the first 2 months, Clarkson and Williams, 2023. The 3rd and 4th months will include developing community engagement activities and engagement with the community. The following 2 months will be spent performing drills, evaluating inexperienced attempts, and enhancing approaches. Long-term goals move beyond this time frame to look at consistent enhancement and sustainable strengthening of vulnerable communities. Another critical factor is role clarity, or to the extent the roles and duties are defined well. Hospital administration will supervise plan execution and budget, identify resources needed and required, engage and greet government and external entities. Medical personnel will develop and enforce triage protocols, provide emergency consultations and care, and participate in disaster relief exercises. The emergency response team will be responsible for coordinating disaster response, managing scenes during catastrophes, and conducting periodic exercises. The public advocacy team will be in charge of community sensitization programs, engaging with community healthcare workers, and having direct contact with target groups. The IT section will analyze the health information management system to check whether data is safe during disasters and how accessible it is. The primary responsibilities of this team will include management of the supply chain, inventories, transportation, and mobile health units. Implementation measures include setting up emergency operation for their activation, developing and translating written video disaster awareness materials, annually briefing staff on emergency measures and medical triage procedures, designing a health worker outreach program for at-risk groups, setting up mobile clinics to be dispatched by the scene, and complying with directed resources and organizations in the community. Collaborations with older healthcare organizations regarding mutual assistance will be established. The plan to maintain the essential hospital capabilities will be created. Designing a staff and community communication alert system, conducting numerous community-based disaster drills, developing a mental health care program for disaster victims and emergency response teams, and implementing post-disaster health supervision and disease rate monitoring. Recovery activities will be monitored using standard KPIs that align with operational goals, creating and monitoring and reporting system for data collection, and an active and regular recovery status check with all stakeholders. A contact tracing plan for vulnerable people will be developed, and a GIS mapping system will be used to illustrate disaster effects and response plans. After the calamity, evaluations will determine the effectiveness of the response and provide feedback to all members of the community and partners. Regularly modify our risk analysis due to new data and experiences, assess the long-term health risks resulting from disasters, and assess the resource use so that the strategy using to allocate resources may be modified if necessary. This process will make it possible to seek new solutions for coping with the community's changing needs in the recovery process. It can reduce health disparities, increase access to services for susceptible populations, and improve cultural and language communication by offering materials in many languages and outreach to persons with physical mental limitations, CDC 2022. It's possible to address the drivers of health that increase disaster impacts and ensure equal and fair distribution of resources and services across community segments, enhancing relations with organizations that serve these vulnerable groups, and using the needs approach in the resources distribution. The staff will also be trained on cultural competency and bias in disaster response, as well as forming an equality advisory council. Assessment of applications will address the disaster preparedness and discover disparities so that all community members will benefit from a healthier community. It is consistent with the pertinent legislation to ensure the highest possible support and adherence implementing the Americans with Disabilities Act in responding and recovering from disasters. The Robert T. Stafford Disaster Relief and Emergency Relief Act will give in our collaborations with the relevant departments to establish disaster relief strategies in compliance with federal grants. Center for Disaster Philanthropy, 2023. The Disaster Recovery Reform Act aims at pre-disaster measures and uses changing in a building code in the recovery process. Federal Emergency Management Agency, 2021. Applicable legal and regulatory frameworks include HIPAA limitations on patient information disclosure in emergencies, state and local emergency management statutes, and public health emergency preparedness and madness. Coordination and cooperation are critical factors in determining the success of a catastrophe recovery management plans. Developing documents in different languages and employing different communication tools to address everyone in the community. Information and support will be provided on a 24-hour hotline, and written information will be disseminated by suspiciously trained community workers in hard-to-reach communities. Hotline et al. 2019. A mobile alert system will be broadcast and update in real time in case of an emergency, offering cross-sectional disaster response training sessions at least once a year to enhance teamwork and rapid response between professionals. Specialized interdisciplinary groups will address specific recovery topics, and all parties will use a synchronized digital environment for data exchange. It will foster collaborative and decision-making through periodic tabletop exercises, while a feedback mechanism will enhance consistent improvement of cooperation, ensuring a unified and efficient reaction to disasters.